An ACL is one of the ligaments in our knee that is responsible for stability. And for many activities in Colorado, including skiing, also hiking on unstable grounds, playing pickleball, etc., the ACL is there to provide stability of the knee when people go from side to side in multiple directions. And when the ACL is injured, it could be that they experience a pop in their knee. One of Mother Nature's flags that something's wrong with the knee is that it's swollen. Another indicator would be that you couldn't continue the activity that you were playing just because your knee just wouldn't allow it. Those are all indicators that the ACL may be torn. And in those circumstances, we would definitely recommend coming in. Most of the time, we'd be getting an MRI, which is the imaging that is used to look at the ACL along with an exam, so we can treat them. The importance of that is not only to get back to activity, but to prevent future tears of cartilage within the knee. And we know that if the ACL is not treated and the knee is unstable, then that can lead to more degenerative changes or cartilage tears in the knee going forward. Because people often ask, what's the difference between our surgery and our treatment of our high-level professional athletes versus the weekend warriors? And I would say really nothing. We use the same sort of surgical procedures, the same rehab, the same algorithms where we figure out the best care to get people back to the things that they love. Sure, we need to do that with our professional players because that's their job, but we understand how important it is, especially for Coloradans, to get back to the things that they love outdoors. There's many ways to treat that. The first of which is understanding, is the knee truly unstable and does the patient truly need treatment? If treatment is necessary, the typical approach is a procedure called ACL reconstruction that uses either part of a patient's own knee, that could be the patellar tendon, part of the quadriceps tendon, to put into the knee in place of the previous ACL that was torn. The cool part of the body is that if we put in a new part, such as a tendon graft, that the body will change that into a ligament over time. And so we use the body's innate ability to heal by putting structure in there. That surgery is typically around an hour of time. Here at CU, we use a very minimally invasive technique, and we know that that's important because of the old days and the real long incisions. Nowadays, things are much less invasive, including small incisions. If we borrow a little piece of bone for the stability, we transplant bone back in, so we make the patient's knee whole. We use plastic surgery techniques of closure, etc. So we take care of the tissues of the knee, and we know that if we do that, we'll have a better chance that it heals to the level with which they can get back to their activity. Yes, and that's the expectations of an ACL injury and return to sport are very high. But there's a secret. The secret is that we need to time the rehab, time the treatment appropriately. And so you can't always just go have an injury and have surgery the next day. There is steps to the process of getting reproducible results. And those results show a very high level of return to any sort of play and sport after ACL reconstruction.